After 2 decades in corporate Europe and going from a burnt out corporate mom to become a health coach, Petra Bartakova's story is absolutely inspirational. She is coming to us all the way from Switzerland. She grew up in the Czech Republic. She has a fantastic story, and she proves that even if you're doing all the right things, eating healthy. As a mom, we're juggling a lot of balls in the air, and a lot of times we're dropping them. And how can we overcome burnout as a corporate mom? So Petra is an absolute expert in this, and I'm excited for her to share her wisdom for all of us who feel like we've just got too many things on our plate, and how can we manage it? So welcome, Petra. Thank you for being here.
Thank you. Thank you for inviting me.
Well, I'm so excited. I know it's late where you are. So we're going to get right to it. And, I always say nobody at this point is thinking of becoming a health coach when they're a little kid. This is something that they've journeyed to somewhere along the way, and they had a former life before. So tell us, what were you doing before you became a health coach? Were you interested in health at all? And yeah, tell us a little bit about that and how things unfolded. What were you doing before?
Yeah, I come from the family of physicians and healthcare professionals, so it has always been very close to me. And I, by myself, studied pharmacy, and I have been working in clinical development for last 20 years, working on developing new medicines for patients with rare genetic diseases, with cancer, and it has been very rewarding and interesting. But somehow on the way, I was feeling there is something missing. There is something more we should be doing for the patients. And also through my own journey, where I was like, for my issues, the only solution was take the pill. I started to more question, is it all we can do? Without proper asking, going to the root cause, what it really is. So I thought there has to be more. I went more to look at the lifestyle changes, and I saw that with the prevention and also through lifestyle changes, we can actually do much more than only with the pills. Of course, there is time for medication. We might need them all, but I believe that we have much more in our hands than we think many times.
Yeah, it's true. There's a time and a place, and so much of what we're dealing with now is chronic disease. And medicine. 25 years as a medical doctor myself. In an acute crisis, it's a great thing to have. It's a great tool to have. If you break a bone, let's line up the bones closer together so the body can do its amazing, miraculous job of healing itself. But over half of the population, at least over in North America here, has at least one chronic disease. I don't know if that's different in Europe, but it's prevalent, and I think it's probably similar. And the medical system is just not really well equipped to deal with that overwhelming inundation with chronic disease. And yet the individual has a great opportunity here. Now so you're going along, you're doing this work, you're like, this could be better. And then you yourself found yourself going, hey, I now have health challenges. In my effort to help people be healthy, I now have I've made myself sick trying to help people be healthy. Tell us what happened, and what just a little bit about that, how that your own health issues and the things that you faced led yourself to do what you're doing now. And even like you said, you mentioned you were surrounded by doctors and that, and would you consider sometimes people were doing that, but they lived a really unhealthy lifestyle
Just
and
exactly
junk food, couch potato. But sometimes, no, they were eating healthy. They were doing all the right things. They were exercising, and yet it still happened. So tell us a little bit about your journey. Where were you at sort of health-wise yourself? And then what happened to you?
Yeah, I think I was thinking I live healthy, so nothing can happen to me. I mean, since my childhood, I've been an endurance athlete, used to really do a lot of exercise, somehow eat healthy, support my, it was part of it, like something, part of my daily life. Always aiming for like training and competing, so used to do a lot. And also maybe this mentality, it somehow transferred also to my professional life. So spending 2 decades in a corporate, I was also used to work hard, around the clock, travel, always trying to achieve the goals, next goal, from meeting to meeting. So it has been always somehow maybe this, so in myself, this coming from me. And then also becoming mom. I'm a mom of 3 kids, and everything together. I couldn't give up on anything. I always wanted it all, you know, be perfect mom, be perfect at work, but still keep my hobbies and my things that I like to do on a quite high level. So I couldn't give up. And of course maybe my also perfectionism. It was difficult for me to let go anything, and I'm also living as an expat in a foreign country. So I don't have here family that would help me as a new mom. Try to maybe take something from my plate. So, and I'm also somebody who has difficulties to ask for help when it's something I cannot do so easily. So I keep everything for myself, which is then putting more and more, but yeah, never letting go. So it's difficult. And
Yeah. If you're listening to this and you can relate to this, I think there's like so many, especially moms, but lots of people who are like trying to do it all, and they want to be good and they at what they do, and they want to be there for their family, and it's just juggling like crazy. And I think it pop in the comments if you can relate to this, trying to just keep all the balls in the air and try to do everything for everyone, and then also let us know how that's working for you. So now it does absolutely help when you're living a healthy lifestyle, diet, exercise, and that, and is that what you were doing, and was that enough?
yeah, and I thought it is enough, but at a certain time, when I started to be, I mean, at around 40, so things started to more fall apart. So my healthy diet, eating carrot and broccoli and exercise, running a lot, were not enough. And actually, I mean, it happened when I was then training for an important mountain race. And of course, with my busy schedule, it was difficult for me, like, to find the time for training. So I had to squeeze it here or there. Of course, then I didn't have, for example, time to eat properly as I would need to. I didn't have time to sleep. I didn't have time to rest because I had kids, job, and all of this was very difficult. And somehow, I don't know, my body stopped to keep on going,
Yeah.
and things started more to fall apart. And I then couldn't get over the simple infection, a respiratory infection, which I was used to overcome within a couple of days and train again. And here it took me a really long time. I couldn't do any exercise. I had to put everything on hold, which was for me also difficult because I was used to do sports and be active, and I couldn't be for quite a long time to get over it. And I really had to slow down to get back on track.
I think a lot of people can also relate to that. I always say, it's like your body says, take a break or I'm going to give you one. I'm going to force you. I'm going to force you to stop. And so it's nice to take metered breaks so you don't have to be forced to one. What kind of symptoms were popping up? You mentioned the respiratory infection, not able to sleep. Now, sometimes people can't sleep because they just don't have time to sleep, that type of thing. And sometimes they have trouble falling asleep or feeling rested when they wake up. What kind of symptoms or issues did you have as a result of this kind of runaway burnout train?
Yeah, I think from all this constant pressure and stress putting on myself, and I was doing it to myself, myself. I mean,
Yes. Yeah.
I really started to have issues like I was waking up at night, my heart racing, constantly running something in my head, what I have to do, what I didn't finish, what I have to like what's coming next day. So this constant running, racing my heart, my mind. I couldn't sleep. Then it was like 2 3 hours I couldn't sleep. I was always overthinking. I started to be more also anxious than I used to be. I was somebody who never really worried much, but at the time it was really things never can make me anxious. So it was around the mind, anxious sleep was really then making me tired. Next day I couldn't function well. I was also more irritated and moody. I didn't have so much patience for
Yeah.
my kids and partner. I also started to have gut issues, from all the stress and pressure. It's very common. Then you start to have some digestive issues. So I had very strong heartburn, and which was really painful. I would never imagine it could be like this. And then I didn't know what to eat. I couldn't eat anything because everything was making me pain. So it was quite.
And literally, with all of those symptoms, at some point the lights just go out, kind of like what just happened to you. So it's kind of like we're there. So we're in that sort of, dark period of your life. How did you come back out of it? Why? I mean, a lot of people are on that runaway train and they're just they're burned out. Actually, before I go there, um, something came up yesterday when I was talking to a health coach, and they were talking about how they were in a group, and these people were saying how there's no such thing as adrenal fatigue. And I remember as a medical doctor, it's not like in one of the lists of diagnoses that people have. Burnout isn't really listed there. It's not like you're listed there. Back in, say, my mother's day or when I was younger, people would go have a nervous breakdown. Well, that nervous breakdown isn't one of those categories either. Whatever you want to call it, it doesn't really matter what you call it. That feeling exists and those symptoms are real. So a rose is a rose is a rose. It doesn't matter what you call it. So that I just wanted to clarify. But basically, this is adrenal fatigue. Adrenal burnout is where you're at. And I remember being stunned. And it was probably when I was in my 40s, 50s, like just like that perimenopausal age,
Mm,
where it's just like there's like you no longer can get away with the stuff that you used to, like pulling
yeah.
all-nighters and that. It's like it's bringing you in check, and so it's kind of a way for a little wake-up call. I think you said it's like a classic, midlife awakening, that you have. So you have these symptoms, which so many people do. Pop in the chat if you can relate to that. And then why why did you change? Like where did you just say, all right, this is enough. I'm not going to keep doing this. I can't. So one thing, you can't do this race because you're not able to do it because you just can't shake this. And in that, was there anything else that was the impetus of turning it around? And then what did you do to try and turn it around?
Yeah, I think the main was that it was not only me. It was not only me like suffering, but because I was I didn't know what to do with it, so I was frustrated. And of course, then when you are frustrated, easily irritated, you are not patient, you are more moody because you are trying to solve something but don't know how, try to find a way, but you don't know
Yes.
which way to take.
Yeah.
So it was not only me, but also my family, my kids. I was not so patient with them. They could see me more, that I'm more down. I'm not so happy, and I don't have also so much energy to do with them so much. And then of course my partner, because we were also arguing much more than
Yeah.
I would love to. So when it started to impact my family, I really was saying, no, I cannot do
Yeah.
this,
Yeah.
continue like this, because it's not only me and it's destroying much more than myself.
Yeah, they say if mama ain't happy, ain't nobody happy. So,
Exactly.
and it's true. And we kind of are the glue. So there is a limit. So what did you do you're like, okay, this can't go on. So that starts with that decision, making a decision. This can't go on. What did you do?
Yeah, I mean, I went from a doctor to doctor, and they always just were focused on symptom, gave me some medication for heartburn, for PMS, but they never asked, and it was not about really trying to understand, and it was more like treating each symptom separately, but not trying to even understand what's behind. They just told me, you're perfectly fine, but I didn't feel fine. And
Mm-hmm.
I think this was more that I really was thinking there is much more behind. It cannot be just, and I didn't want to take a medication and just forget what is happening just to.
Yeah.
So I tried different medications on the beginning, and then I didn't want to take more and more. I tried different courses. So I had the coach to help me and different programs. Of course, I was Googling like crazy. What should I
Yes.
do? So
Yes.
looking all over and then somehow I put the picture together, and it was more like a puzzle coming together that I have to look at everything more holistically and because in the end that everything was interconnected and linked to my too much stress, too much pressure. And yeah, this was when I realized I have to do something more and start something else, because my healthy diet and exercise were actually not enough, and I had to look at it more holistically and start to put it as a puzzle together. And as I was looking at it, I was like, yeah, there is much more than just a
Yeah.
symptom.
Yeah.
And this is how my way started. And I got to the program when we look at the things holistically, and one thing supports the other. It's so interconnected, and I was so fascinated. I said,
Yeah.
I have it there.
That's fantastic. And so what all improved for you? So you pieced it together, you took control of it, you did your research, you got a piece here, a piece there, you got a lot of things. You're like, well, that's not going to help. That's not going to help. You knew everything's connected. And so you put it together. What were some of the results that you got?
I can sleep. I really
Yes.
sleep. I'm not waking up at night. Um, and this is a major, because then I started to be worried that if I go to sleep, I will wake up and I will not be able to fall asleep again. So I was even worried to go to sleep. Now I am happy to go to bed. I
Yes.
sleep, and that's a major, because if I didn't sleep, I was then tired, irritated, moody. So this has improved also all my other symptoms. I don't have anxiety anymore. I don't have sleep issues. I don't have heartburn, and also all my moodiness has improved. So basically all the symptoms, I found a way to get rid of them. So
I
this
love
is
it.
really
Uh,
me too.
Yeah, and then everybody is happier, right? The whole family is
Yes.
happier, and the relationships are happier, and you can be the mom you want to be, and so good. So, is that what led you to become a health coach? Like having to kind of tough it out and find your own trail through that, and then once you have it, and then recognizing that, oh my gosh, so many people are suffering, like just like you did, and you're like, I found something that could help people. I found a path. It's not like a pill. You didn't find a pill that would help people. There is no pill, but I found a pathway, a roadmap that people could follow to get similar results. So is that what kind of led you to become a health coach?
Yeah, definitely finding my own way. And because I always had passion for active and healthy lifestyle, and I was like, I want to share this because I know a lot of corporate moms struggling the same way as I do. So I want to help them. And I think also from my background, like the get also close to the patients, I
Hmm.
mean clients, patients as we call
Yes.
them, that I could really also help directly, working with people directly on their health journey. So it would be more direct collaboration and help the others. So it was always I always had it help others, but through this somehow the puzzle again was fitting together all the
Yeah.
pieces, my
Yes.
passion, my background, and my own health journey fitted. And this is let me like, yeah, this is what I want to do.
Yeah. So
Sharing and
good.
help.
As I call it, soul satisfying. It's soul
Yes.
satisfying to do that work. And it kind of gives the trouble that you went through meaning. It's like, I did go, that was really hard, but now I can make it easier for someone else. And you know, it's kind of the one of the ways that we learn. And I love health coaches in their ability to give back and help people in, you know, through what they went through and just to make people's lives a little bit easier. Who specifically do you focus on as a health coach? Who are you passionate about helping?
Yeah, so based on my experience, I really love to help burnout corporate moms get rid of anxiety, sleep, and gut issues so they can again enjoy more balanced hormones, moods, and of course the relationships and also productivity. So that's very close to my heart because it's coming from my own experience.
Yeah, you know firsthand. You've walked those shoes. You know exactly what it's like. And you know, like you have compassion for them because you know, hey, I was trying to do everything right too. And it wasn't enough. And that's so frustrating because you're like, I am doing this. I am, you know, and even if you're not, like you have a stress relief valve. So the outlet might be something that as a way to cope, you might be just doing the best you can with an avenue as well. So I love that you have that compassion for people. What do you like best about being a health coach? What's your favorite part?
Yeah, I really this what I said before, helping people,
Hmm.
working with people on one-on-one, and being part of their journey, supporting them on their way to finding the way through from their symptoms,
Hmm.
issues, and it's really rewarding and also very interesting to work so closely with people. And often you become also friends because you in the end find out that you have so much in common,
Yes.
so it's very also very close collaboration, and they have to trust you, of course, and you also share so many things which you kept for yourself. So it's very rewarding this close.
What has been something that you've learned from working with your clients? I know that, you know, it's one thing when you're going through a journey and then you start to recognize patterns. I noticed that for myself. As I was working with clients after clients, and you're like, interesting observation. So, what have you noticed from being a health coach?
Yeah, I have noticed that there are similarities, but we are also all slightly different. So, I mean, there's not one solution fits all, and you have to also adjust based on the needs and
Yeah.
preferences of each client. So it's also very interesting because sometimes you have to look at the same thing but slightly differently.
Hmm.
But also I have learned a lot that it's a lot about um, people come also because they want somebody who listens to them, somebody with whom they can share their issues, because they might have heard from the physician everything is fine, or at home they tell them you are fine, just just take the hormones, or I don't know. And so it's a lot. They really also like to find somebody who really listens to them, to their issues, and understands. And that's why also maybe I connect nicely with those corporate moms because I have been
Yeah.
in their shoes,
Hmm.
and they better talk to me because they know it's possible, and I have been in their shoes.
Yes. Yeah.
Something, yeah.
Yeah, no, I love that. So, as somebody who has been helping burned out corporate moms overcome gut issues, anxiety, sleep issues, what would you say is a common myth that people have when it comes to overcoming burnout? And it's global. You're in Switzerland, but I mean, it applies to everybody. What would you say is one of the biggest myths when it comes to overcoming burnout?
Yeah, I think I really like it. It's like everything is interconnected. Our
Hmm.
physical, mental, emotional health. It's not just this is what I was like often around the symptoms, but they are so linked. And often, if you treat one, it gets also some other thing gets better.
Hmm.
And often the care is more focused on finding the quick solution for your anxiety, for your sleep. But we have to really look at everything holistically as a whole and put things together. And then you are really surprised how much you can influence not just maybe your gut issues, but also anxiety, sleep. It's so fascinating how everything is connected, and people often underestimate this
Yeah.
because it's not looked only or cut into pieces.
Yeah, you're so right, as you were sharing before about the interconnectedness. And it works both ways. The anxiety exacerbates the sleep, which
Yeah,
anxiety exacerbates the gut issues, but then vice versa, as you get to the root of it and you deal with all of those root things. And as you said, nutrition alone was not it. You were already eating healthy and you were exercising, you were an endurance athlete. So just that in itself wasn't enough. It's a part of the puzzle, but by getting down deep into the root, then once you start with that great foundation, then everything gets better. And there's like those spin-off benefits. I always, and it just gets better and better. I love that. That's just fantastic. And that there really isn't, I agree with you, like not, one size fits all. It's not the quick fix. If we're not addressing the underlying imbalance, things are just going to rear its ugly head one way or another, in some way, shape,
yeah.
or form. So important. I love that, Petra. Uh, to our audience who's listening, can you relate to this? Or have you found that when maybe you made one little small change in your life that was positive, that other things started to get better too? Maybe you had maybe a not healthy diet and you started to improve that, but then your mood got better and your energy got better, and then your relationships are better. And then have you also seen the opposite effect? So let us now know in the chat if any of this is resonating with you at all. And also, if you're listening to this and you're a health coach or aspiring health coach, and you're thinking, well, I have been through stuff. I think I have an expertise. I just don't know how I could go and now take what I've learned and go and help more people. But that's really what I'd like to do. I'd like to do what Petra's doing, and I'd like to help more people. If that's you, check the description of this video. There's a link to how to ignite your health coaching practice in 90 days. So check that out. So, Petra, how have you grown? I always say your business can only grow to the extent that you do, and that through this experience of helping others, through the experience of healing, but through the experience of helping others, you grow as a person. So, how have you grown? It's really, I'm going to say, becoming a great health coach is a phenomenal personal development process. It really is. So how have you grown, would you say, in the process of becoming this excellent health coach that you are?
Yeah, I think this is what you said now. It's a constant development, constant learning, and also working with different people, different. So I really like this part because I have learned a lot also for myself. Whatever clients are sharing, the way they are looking at the issues, trying to handle, this is also always a great experience for me and giving me also a different picture, different points to consider next time, because from one client I can also learn for the next client. Have sometimes it's like again putting the puzzle, making it more complete everything. So it's a great learning for me, and also for myself. I'm also learning from the clients, also for myself. I now have the tools. It doesn't mean that I never have a sleepless night, but I know how to get back. For example, if I have too stressful period, I have a lot of tools and I know how to balance myself much quicker, and I'm also much more resilient. So all of this from my own journey, but also from my clients, I now also know much better how to implement it really and use it in a daily life. So
Yeah, very good.
uh,
Yeah. So if you had to, you know, once you've been through, some people call it a dark night of the soul, but once you've gone through those tough times and now you're on the other side of it, there's a learning that you learn. And when you look back, it's sometimes nice to anchor in that learning. And a lot of times the messages that we tell our former self are the same messages our future self would tell our current self. But if you had to, or if you got the opportunity to go back and tell your former self some advice, what piece of advice would you give to your former self?
I would say slow down to go faster,
Mm-hmm.
and slow down and listen to your body, what signals and it's giving you, because it's important to listen to our bodies. And often we overlook, we don't want to hear those
Yeah.
signs here and there, but they are important messages for us to follow before things get really worse. So if you listen on your way, everything will be easier. And don't wait until it always till the end, but
Yeah.
listen on the way to the signs. Yeah.
Yeah, so good, and I think that's why both of us, do what we do, and what led me to leave medicine, and I wanted to help people get out ahead of it, and not have to wait until it got so far out of control that we need that those acute sort of
Yeah.
emergency procedures and things like that. There's an opportunity well in advance if we're tuned in. So yeah, if we're listening to that and just not dismissing it and just like, yeah, I don't care what you need, body. I don't care what you need, spirit. I don't care what you need. I don't care if you need a break. We're just going to do this anyways. And then you can only get away with that for so long. And then it
Yeah.
starts to come and collect the toll for
Yeah.
that collect the price, that the cost of that. When helping people, you mentioned so far, before about being interconnected and how we're all interconnected. So then, of course, then there's the spin-off benefits. When you help people with one thing, there's a little ripple effect of all sorts of things that can happen. I love to hear the stories of the spin-off benefits. Do you have one or two people that you've worked with, clients that, where, they came to you for one thing and then they got so much more than they bargained for? I love
Mhm.
to hear those stories.
Yeah, definitely. I think it's in most of the cases that they come with one single thing, but then you see the improvement in other things. And I was just working with a client and she came with gut issues, which were really a burning issue for her because she couldn't eat. She couldn't go outside to the restaurant and eat what she would like. When they were outside for on a trip, she always had to think what to take. She couldn't have an ice cream and enjoy summer. So it was very strong, like around the gut issues. But on the way, so I mean, we started, of course, with nutrition, but during the sessions and the time working together, it revealed actually it was not the main root cause of her gut issues. So we had to work much more on her mindset, self-care, stress management, and all these things. Because, and when we started, yes, of course, she was also eating more healthy, but also when we started to manage her more this emotional, mental part of the thing, things
Yes.
got much better, and it led not only to suited gut, but also and enjoying in the end that she could go to a restaurant and eat normal normal dinner as she
Huge,
would like
right?
to.
Yeah.
Yeah, but also she was really feeling more. She had more also tools how to be more stronger, more resilient in stressful situations, and be also maybe more emotionally stronger, because it was also important for her family, so she can also enjoy the time with her kids. So it has an impact also on everything, like it has a stronger connection with emotional and mental health for
I,
her.
I think that's huge. And I think it's often underappreciated. Resilience is everything. If you had to have just one core skill that you relied on, like I would pick resilience, because life is going to happen and it is as it is. And none of us gets through this life unscathed. Stuff's going to go down. I can guarantee you. And it's not all rosy as much as we'd like it to be. So stuff's going to happen. And to be able to adapt and have tools to allow you to, as I call it, surf the waves, right? That are coming, rather than get swallowed up by them. Huge. Just, so it's one thing, heal your gut. Yes, so awesome. You can go out to a restaurant, you can eat without having all of those uh, heartburn and bloating and all of the discomforts and other digestive issues that really bring in. Those digestive issues are not just gut issues. It brings your
Mhm.
whole world in. You can't go out with friends. You can't socialize. You can't maybe make the deal for corporate because there's the dinner parties and things, but you're in
Yeah.
the bathroom. And I mean, it sounds like on paper, it's not that big of a deal. For the people who are suffering, it's a big deal. And so to be able to heal that is great. And then also to be able to have resiliency so that you can navigate life and have a happier, healthier family and have peace around that. Huge, huge, and really getting it into balance. So I think that's so great. I remember you telling me about another woman that you worked with. I think you said she was tired of being tired, and on the hormonal roller coaster. Tell us about that woman.
Yeah, it's also a common thing. I think ladies so around 40 come with that they feel more on a hormonal roller coaster.
Yes.
I think from all also the stress around, it's nothing to be surprised about. And she was complaining being on a hormonal roller coaster, having strong PMS before her period, and
Hmm.
also her skin was getting much worse. She was complaining about being moody, and of course, again, not having patience for her kids, for her partner.
Yes.
And after a couple of weeks implementing the protocol we have been working on, she was then once she was like, I have to tell you, I had my first cycle without the PMS, and she was so excited, and I was like, yes. And
So good.
after like all the struggles, she was really happy that she had some things that could suit her PMS, because it can be really also tough period for a woman and also her family.
Yeah. And I think the crazy thing, which a lot people who are suffering don't necessarily realize or recognize, but people struggle for years, decades with that. And then her very next cycle, so within weeks, no PMS. I mean, oh my goodness. Like your protocol, the process that you honed the hard way, but your process that you walk people through is fantastic and effective. And all the genius things really are generally simple, right? So they're kind of easy to do, easy not to do, but it's about implementing them
Exactly.
regularly, consistently. So good. And then you can be the mom you want to be, and you can be the partner that you want to be. And uh, because nobody wants to feel out of control. It's almost like, who is that person saying it? It's coming out of my mouth, but I don't mean it. And it's like, so just to be able to get back in control of and steer the ship and feel good, and yeah, just very, very good. I love this, Petra. You're doing an incredible you're having an incredible impact in the world, and I love that you are helping women in this way, especially when and who have been burnt out in corporate. But all moms kind of can feel like that,
Yeah.
where they're going in a million directions, and so many of them are struggling with adrenal fatigue and stress and burnout, which exacerbates all sorts of things. And if somebody's listening here and they're stressed and burnt out from maybe an illness like cancer, like our one of our health coaches, Sherma Henry, take a look at this video here of our interview where she was doing all the right things like Petra here, but instead of burnout, hers wound it up in cancer, and how she overcame that. So if you know someone who is going through that and wondering how can you overcome that fatigue and anxiety and get your life back on track there, check out that next interview. Petra, how can people get in touch with you if they're a busy mom and they're just like burnt out and they're just trying to figure out, like, I would like to ease my PMS. I would like to heal my gut. I'd like to be able to eat at a restaurant again. I'd like to be this happy mom again. How can they ask you questions? How can they find you?
So they can check out my website. It's easy one. It's my name, which is not that easy, but it's petrabartakova.com. Or they can find me on Instagram. It's the same, Petra Bartakova Health Coach. So I think it's all linked to the name, and it should be easy to find.
Okay, I'm going to spell that out for everybody. Easy for you to say. So Petra, so the website is Petra, Petra Bartakova, BARTAKOVA.com, PetraBartakova.com, and at Instagram at Petra Bartakova Health Coach. So check her out. She's absolutely lovely. Thank you so much for being here. I super appreciate you and
Thank
sharing
you.
your insights and your incredible story. Thank you.
Thank you for inviting. Thank you.
Awesome. Well, if all of you, thank you for listening. Check out that next episode. And if you have questions or comments, be sure to include them. All right. Be good for you.